One of those topics that is so easy to brush to the side, but it can be life-saving if treated correctly and really dealt with correctly. Well, we had a chance to sit down with Dr. Martin at RIA Endovascular to, chat about some of these touchy topics, and they've really got a lot of solutions to help you out. Take a look. Let's dive in with some of the basics. What does somebody like you, who's an interventional radiologist, do on a daily basis?
So, an interventional radiologist is a physician who does minimally invasive procedures. What separates us from other physicians is that we use imaging guidance. As a radiologist, we're specialists in imaging, and we're able to use imaging guidance to perform surgeries that previously required open incisions, that we can now do them minimally invasive with minimal downtime and equivalent or better results.
Yeah, and that's what people are always looking to hear. Minimally invasive, quick recovery times. What are some of the other benefits of interventional radiology?
I think the major benefit is we can do things outpatient, minimal hospital stay. We can do things, again, because we're using imaging guidance, the risks of complications are much lower, and we're able to, again, provide adequate care with minimal invasion.
Awesome. And you have a particular topic that you want to discuss today that's really going to help a lot of our viewers out.
Yeah, could be helpful to many viewers. What we're going to discuss today is something called prostate artery embolization. So embolization, what that word means, it's a long word, but what it means is blocking off blood flow. And so the prostate artery is the artery that goes towards a man's prostate, and embolization means blocking off blood flow. What this does is it results in shrinkage or decreased size of the prostate, which helps with symptoms, because men who have enlarged prostates can have significant life-limiting symptoms from their enlarged prostate.
So for men who are out there saying, gosh, this might be me, what are some of the symptoms they should be looking out for?
So the major symptoms have to do, obviously, with urination. So whether they're urinating frequently, they could have urinary urgency where they feel like they have to go to the bathroom really quickly or they're not going to make it. They wake up multiple times a night, 3 or 4 or 5 times a night. You can imagine how difficult that is, not getting the sleep that they need. It can often affect the urinary stream, where they cannot urinate as well as they used to. It's hard to stop urinating or to start urinating.
Now, when somebody comes in, makes that first consultation and appointment, how do you make that accurate diagnosis at RIA?
Yeah, so luckily most of our patients have already talked about this with their primary care provider. And oftentimes they've been referred to a urologist. And we work in conjunction with primary care providers and urologists to make sure that the adequate diagnosis and an appropriate diagnosis is made. There can be some overlap with other conditions, so it's important to get an appropriate diagnosis.
Walk us through what those treatments are like for the patients that do make the choice to come in.
Yeah, so the treatments for enlarged prostates really depends upon the severity of the symptoms and also depends on what they've tried in the past. So most patients who come into their primary care provider are usually started on some medications and also some lifestyle changes, such as limiting water intake before going to bed. For those patients who continue to have symptoms, even after conservative management, they're usually referred to a urologist, who they have surgeries and other treatments to treat an enlarged prostate. We're kind of the third part. And because this is a newer procedure, we want to make sure that patients have all the information to make an informed decision for them. We work very closely with urologists. In fact, I recommend that every patient see a urologist so they can know what other options are available to them for their enlarged prostate.
So, Dr. Martin, what's the patient experience like once treatment begins?
Yeah. So we always see our patients in clinic to give them an idea of what to expect for the procedure. Now, I will tell you, for the vast majority of patients, it's done as an outpatient procedure. They go home the same day. The procedure is not generally very painful at all. We gain access to their arterial system through a small incision in their groin. We find the vessel going to the prostate, and we block off blood from the prostate. What's great about this procedure is they generally do not go home with a catheter, which most men appreciate, and that also they tend to start getting better rather quickly. We usually see our patients back at about a month after the procedure, and I'd say nearly all of them have a big smile on their face. They say about 1 week to 2 weeks after the procedure, their symptoms have already started to improve. And what I tell them is they'll continue to get improvement up to 3 months after the procedure. As that prostate continues to shrink, their urinary symptoms will improve.
That is great to hear. All right, well, as we wrap up, let us know where we can set up that first consultation and learn more about RIA.
Absolutely. They can go to our website at riaendovascular.com. or they can give our clinic phone call at 720-493-3406. Or we also have a Northern Colorado clinic. Their phone number is 303-930-2849.
All right. Well, thank you for all the information on men's health. We'll see you soon.
Thank you very much.
The doctors at RIA Endovascular are trusted, renowned, and use minimally invasive treatments. If you feel like you're suffering from any of the symptoms related to prostate artery embolization, give RIA Endovascular a call at 720-493-3406. Learn your treatment